Good evening. I'd like to welcome you to the May meeting of the Pitt County Board of Health. I would like to ask for any public comments first. Okay, hearing none, we'll move on to the minutes of the previous meeting. Those have been distributed earlier. Are there any corrections or additions to the minutes? Hearing none, is there a motion for approval?
So moved.
Is there a second? Second. Any further discussion? All in favor say aye.
Aye.
All right, thank you. The minutes are approved. We'll move on to the fiscal report. Marcia Hall.
Yeah, closed session minutes too also.
Oh, okay. Yeah.
All right.
Your financial report should be in front of. Does everybody have one? We had no budget revisions in April, resulting in no change to the first three columns. Our revenues and expenses are both below the prorated projections for this time of year, reflecting in the $616,552 deficit. DHHS state funding for April, county appropriations, and the 2017 Medicaid cost study contributes to our timing items. If you take into account the timing items, we were actually with a surplus of $179,000. $179,547. With EPIC and budget workshops, we're working hard to wrap up the many programs that have service periods ending in May and submitting the documents for the 2017 Medicaid cost settlement. We received notification this week from Duke Endowment. They are contributing $52,000 to our Nurse Family Partnership Program, which will help us bridge the gap to the new state funding cycle in June. If you could look at the last column of the spreadsheet, you will see that the Medicaid revenues actually increased in April by $8,000 roughly. Our clinic fees are down by $23,618, which was actually expected due to EPIC. We are 21 days in our new system. Environmental health fees are slightly down $10,000, but we expect them to be on target or even increase due to the weather and time of year with the pool certifications on the horizon. Dr. Morrow presented our 2018-2019 budget request to the Board of Commissioners on April the 26th. No approvals yet, but a 2% COLA effective January the 1st is still in that budget that we know of at the moment. And our overall budget request was $11,776,638.
Marcia,
yes,
before
sir?
we go to the 18-19 budget, let's we need to get approval of the fiscal report for the
Oh, I'm sorry.
and make sure we don't have questions about that.
Okay.
Well, speaking of, thank you, Dr. Morrow. Are there any questions?
Sorry about that.
That's okay. Does anybody have any questions about the monthly report here?
Move to approve.
All right. So the motions are second.
Second.
Second. All right. Any further discussion? All in favor say aye.
Aye.
Any opposed? Okay, the report's approved. So speed on over to the 18-19 budget.
Okay. I guess it's the TV that makes me nervous. So Dr. Marr presented our 2018-19 budget request to the Board of Commissioners April the 26th. No word on approvals yet, but we do believe that a 2% COLA is still in that budget packet. And our overall budget request was the $11,776,638. Included in the county manager's budget is a 0.25 FTE for a diabetes nutritionist position at the health department as well. Any questions?
All right. Does anybody have any questions about the updated budget request? Mr. Colson, any comments?
None. I expect the budget will go through as it now stands.
Yes, sir. All right.
So that'll be June, the first meeting in June is when it plan is to.
I think it's the Tuesday after that,
Okay.
I think.
Okay.
I'm not entirely sure.
All right. So any other questions for Marcia? All right. Thank you very much.
Oh, you're welcome. Thank you.
Staffing update. Is that?
That's me.
All right. Dr. Morrow.
Yeah, thank you, Mr. Chairman. Let's see where I put my piece of paper. We have about 13 vacancies currently. I think we discussed this a little bit at the last meeting, but I just wanted to update you on the status of that. Currently we have, here it is, 8 positions in the personal health division, with 6 of those being nurses that we're actively recruiting for. In the WIC nutrition division, we have 3 vacancies, including 2 nutritionists. Environmental health, we have 1 vacancy. We had an employee recently from the food and lodging division who left us to go to work for the state public health system. So we're recruiting that position. I did mention to the county commissioners we are significantly behind on on-site building authorizations right now. Mark Phelps informed me a couple of weeks ago that we're probably 6 to 8 weeks out right now. And our staffing on that has, we're down 2 people from where we were in 2011. We lost 2 positions in 2011. So in terms of the request for permits, we're back to where we were prior to the recession in 2008. So that's what's causing that. So as I informed the county commissioners and the county manager, I think if we're going to address that, those guys are working as hard and as fast as they can right now. If we're going to shorten that waiting period, it's going to take more staff to do that. So, and then administration, we do have one vacancy there also. So we have 13 currently vacant positions. So we hope we'll at least have a few of those nurses and nutritionists and maybe an environmental health specialist hired sometime soon.
That sounds great. Any questions, Dr. Morrow?
The other thing that I would just comment, Mr. Chairman, is the EPIC workflows. As Marcia mentioned, we're day 21 of the EPIC system. We met again with the EPIC staff from Vidant today, and they are continuing to consult with us on getting fixes done as we find things that we need to do better. But we still have a lot to learn with that system, and so we know that it is going to impact our workflows, and hopefully will create some efficiencies. We feel very sure that it will create efficiencies, but so that could impact some of these positions, but right now we need nurses. We're critically short on nursing staff for the clinic, and we need that to even get the workflows and the EPIC system working properly. So our hope is we can recruit as fast as possible and get those positions filled.
Well, I can assure you we had similar challenges at Vidant with EPIC when it first was implemented there. So, okay, if there's no other old business, move on to new business. The Regional County Health Assessment, Amy Hatton.
Well, good evening. If you remember back in January when you had your last Board of Health retreat, you were introduced to the Regional Community Health Needs Assessment approach, and so I want to share an update with you about that tonight because we really have moved forward with that and got some exciting things going on. Okay, just to give you a background about the Community Health Needs Assessment, and especially for the community members that may be watching, the Community Health Needs Assessment is required of all local health departments within the state of North Carolina, and it's also part of our accreditation process. In addition, it's also a requirement of not-for-profit hospitals, and that's a requirement of the IRS. The purpose of the CHNA is to identify the county's health needs, and to implement a plan of action to address those needs. And of course, we do partner with our local hospital, with Vidant, to do one needs assessment. There's no need to do two, so we pool our resources and work together to do one. So the regional approach, this is something that's new to Eastern North Carolina, as was explained to you back in January. The process began well over a year ago, and it was led by the ECU Office of Health Access through the Brody School of Medicine. And they partnered with Vidant Medical Center and numerous other county health departments. Now there's 33 counties, including Pitt, that have joined this effort, so it's really expanded. And of course, Pitt County Health Department was one of the lead health departments in that. And we do have to give credit to Dr. Morrow. He was on the original leadership team to bring this concept to Eastern North Carolina. So the purpose of the regional approach, there's several benefits to having this. One, it allows for the comparison of data across counties so that like data can be shared from county to county. It also helps to better identify and compare health problems across counties, and it encourages counties to work together on those like issues. And not only that, it helps to support grant applications. Many times, grantors will only fund counties if they're a certain population size. And Pitt may, have a chance at some of those grants, but some of our smaller counties do not. So pooling our resources would help us to get more money into the county and into the region to address these issues. So as far as assistance with the program, with the regional assessment program, thanks to a grant from the Duke Endowment, an outside vendor has been hired to provide data and data analysis for each county. And this is a huge asset because in the past, each one of our counties, we've been doing that ourselves, and which takes a lot of time to hand count all this data and collect it. So now we have a vendor that can do it and do the analysis. The grant funds from the Duke Endowment helped also lower the cost of doing the assessment because it takes far less time for our staff to have to calculate all this data individually. And not only that, Vidant Medical Center, many thanks to them, they actually paid our portion of that for the county, so there were no health department funds that came directly out of our budget to support this. So very thankful for that. And now the Foundation for Health Leadership and Innovation is overseeing this grant and the regional assessment process. So part of this is collecting primary data. So right now we're in the middle of collecting primary data or community feedback through an online survey that's through SurveyMonkey. We have sent this survey out. It's for all 33 counties, and every county has sent it out in some form or fashion. We have it on our Facebook page. It is on our Pitt County government website, on our health department website. It's also on Pitt County Schools website and many others. And it started in mid-April, and it will run through June 30th, and we can continue to collect data through that time frame. And this is the survey link here. However, it's much easier to access the survey by going to one of these websites. There again, as I listed before, the Pitt County Health Department, Pitt County Government, and there's some others there, Vidant Medical Center as well. And we also have it on our Facebook page. To date, over 500 surveys have been completed just in Pitt County alone. Pitt County right now is the lead among all of the 33 counties in the collection for the surveys. I think it was 559 when I left the office. That was the last count that we had, so it's continuing to climb. So between now and the end of June, we should have a large number that's collected. Back in 2015, I think we collected 535 for the whole needs assessment process, so we're standing to collect a lot more. In addition to the online survey, we're also getting ready to conduct community focus groups or listening sessions. Just today, we launched a training, well actually the vendor launched the training to train staff across 33 counties how to do the focus groups. We want to make sure that they're all conducted the same way so that we can compare the data. And right now we're training health department staff, staff from Vidant Medical Center, and Pitt Partners for Health members. And we had a room full today that was part of that training, and we have 2 more trainings to attend. So there's about 15 to 20 staff members that will be participating in the training. We'll also end up probably doing about 15 to 20 focus groups. The vendor has asked that each county do 3 to 5 focus groups. But in Pitt County, in the past, we have generally done probably close to 20 groups. We do these a little differently here in our county than some other counties do. We have found that by doing the groups among groups of people such as school nurses, social workers, youth groups, civic and service groups, as well as churches, those groups are more likely to give more accurate information about the health needs because they're serving individuals that are coming to them for help. So we have had very good success with taking this approach. So we'll probably end up doing there again about 15 to 20 between now and the end of July, and that's when the cutoff would be for doing the groups. The sample questions, and this is just a few of the questions that will be part of the survey. We're asking people to tell us what they think is the best thing about living in the community. What do people in this community do to stay healthy? What are the serious health-related problems in your community? Some other questions: what are some causes of these problems? What keeps people in your community healthy? What could be done to solve these problems? And also, is there any group not receiving health care, and if so, what group is that? So as far as the analysis of the primary data through the online survey as well as the focus groups, we will be submitting the, the data from the online survey is being submitted directly to the vendor anyway, so that cutoff is June 30th. Our focus group data, we will be submitting all that by August the 6th. And then the vendor will prepare an analysis of all that data and a report that will be sent back to us, and it will be incorporated into our final Community Health Needs Assessment document that will be published in March of 2019. And I do need to say that, I forgot to say this early on, that the regional assessment does not take the place of each county assessment. There's a regional assessment, but then each county still is responsible for having their own document that's just pertinent to that county. In addition to the primary data collection, the vendor will also be collecting secondary data, and this is what we have done in-house in the past. That will actually started in March of 18, and it will continue through October of 18. That data will consist of things such as the leading causes of death, county demographics, and they'll continue to collect that through early fall. After that, once all the data is collected and given back to each county, then we're going to start presenting data to various groups in the county. And y'all all familiar with Pitt Partners for Health, which is our grassroots organization. It's administered through the hospital. It's comprised of community members, various health and human service agencies. The group's been around for 23 years, and through that group, we do select priority areas to work on within the community. So the data will be presented to Pitt Partners for Health. That will be done in November, well, actually in October. They'll have a month to think about the presentation and the data that was shared, and then we'll come back in November to select priority areas for Pitt Partners for Health to address. And that will be for a 3-year time span until the next assessment process begins. As far as the Health Department and the Board of Health, that will take place in November. Dr. Morrow will be inviting y'all to be part of another retreat. We will need, for our accreditation process, we will need to have another retreat to renew or update, revise our strategic plan. Many of you remember back a few years ago we met back in January and formulated the plan that we have now. We will have to renew that plan because we're getting ready to end those goals and objectives that are in the current plan. And part of that, we would want to introduce the primary and secondary data to you at that point in time so we can include the assessment information in with the strategic plan. And so that will take place in November. And then in March of 2019, the final document is due. It's always due the first Monday of March to the state. And Vidant Medical Center, they have until September of 2019 to post the final document because their fiscal year is different from ours. It'll be the same document, but they can post it any time between the publishing in March up until September 30th of 2019. And then following that, we will create action plans. Once we have collected all the data, then we have to decide, well, what are we going to do to address the data? We'll comprise health priorities, action plans. We'll bring those back to you for approval, and then they will be due to the state in September of 19. Vidant Medical Center, they also have action plans, but they call that an implementation strategy. So sometime between July of 19 to September of 19, they will be working on those that strategy, and then the Vidant Medical Center board will adopt that, and then they'll post the final document on their website as well as the implementation strategy. So then the work begins. We'll continue to collaborate from September 2019 to 2023 and beyond. I say 2023 because that will be when the next cycle is up for this needs assessment that we're working on now. But the health department, the hospital, Pitt Partners for Health will all continue to work together to improve the health of all people in Pitt County through the work of our action plans, the hospital's implementation strategy, and then Pitt Partners for Health action teams. And then all of this work will be reported out to you as we do annually with the State of the County Health Report. That is a requirement from the State Health Department that we do what we call a SOTCH report, or State of the County Health Report, and that is also shared with the community. And then we'll start the cycle all over again. So any questions or for any more information, the community can contact me at the Health Department, my phone number or email.
Well, thank you very much. Does anybody have any questions for Amy?
Thank you.
Well, I'll tell you, I recently completed the survey. It didn't take very long. It's mostly multiple choice. But there are opportunities for you to put in your own comments, concerns, observations, so forth. So we certainly want a broad-based representation of folks in the county providing input. That's the only way we can actually get a good broad representation is for folks to fill it out. So I encourage you to do so.
I'm glad you said that because we just found out today from the vendor that we need more males to take the survey. We have mostly females according to their demographics, so if we could get more males, we're going to reach out to some men's groups in the community now that we know that, and hopefully we can get more male input.
And again, you said it goes through the end of June. Is that when it closes?
Yes, sir.
Okay.
Through the end of June, and the focus groups will go through the end of July.
Okay, very good. Thank you very much.
Thank you.
Let's see, the Pitt County Improvement Group, Dr. Morrow's going to report.
Okay, I've got a slide I want to pull up there. Okay. I want to talk to you a little bit about the Pitt County Health Improvement Group. We've had a little bit of conversation about this group in the past. This started back in 2013, and it started basically as a result of our county health rankings that come out annually. 4 years ago, this is our what I'm showing you on the slide there is our current, most recent health rankings that just came out, and I showed these to y'all last month. But 4 years ago, there are two areas here you can see. The top one there is called health outcomes, and that's made up of length of life and quality of life. And you can see over to the right side that Pitt County ranked 51st. Now that's out of 100 counties in North Carolina. So one being the best, 100th the worst. So we're actually on the south side of being average, I'd say, on the health outcomes. The other category there is health factors, if you go down a little bit farther. And that's made up of several other factors, health behaviors being one, clinical care, social and economic factors, and physical environment. So that's what makes up the health factor rating. You can see that our rating for health factors currently is 58th. Now, 4 years ago, our health outcomes was ranked 46th out of 100, and our health factors, we were actually ranked 34th out of 100. So we brought a group together that included the CEO of Vidant Medical Center, that was Steve Lawler at that time, and the dean of the medical school, Dr. Paul Cunningham, and myself, to talk about how can we change that ranking, improve that ranking, and we originally wanted to be in the top 20 by 2020. As I said, since 4 years ago, we've actually been going backwards. Now, the reason that we're going backwards is not necessarily because we're doing bad things or getting worse, but a lot of it has to do with other counties getting better. So it's a ranking out of 100. So we're being compared to the other 99 counties in the state. And if those counties get better than we are, then our ranking falls. And for the most part, I think that's what's been happening. So this past year, our Pitt County Health Improvement Group, we've expanded a little bit. We've expanded quite a lot, actually. But both Steve Lawler and Paul Cunningham have left their positions. And so we've been working with other staff from those agencies, particularly Mr. Al D'Elia, who Amy just mentioned, who had helped us a lot with our regional community health needs assessment and other projects that he's been very actively involved in. And unfortunately, Mr. D'Elia is leaving Pitt County next month and moving to Maryland, where he'll assume a position with a university up there. So we really hate to see him go. But he's been helping us with this Pitt County Health Improvement Group, and Dr. Paul Shackelford from Vidant Medical Center has also been really actively involved. And thanks to Dr. Shackelford, he was able to pull in some of the staff from Vidant, and they took a really deep dive into our rankings to look at what are the specific areas that would make the biggest impact, and that we felt like we could push that ranking up faster with. And I think, I guess the main question here that people might be asking is, why do we care what our ranking is? I think the answer to that is that it really plays a significant role in our economic development. When businesses are looking at places to locate or expand businesses, they're looking at things like these rankings to see, are they going to have a healthy workforce? Is this a healthy place for their employees to live and raise their children up? So these rankings are really important, and so we've delved into this quite a bit, and I wanted to bring you up to speed in terms of where we are now. I gave you a handout that Mr. D'Elia actually helped draft this document, and we had a meeting about 2 weeks ago with some economic development folks from the county. We brought together a group to look at how we could get the Chamber of Commerce and economic developers and planning and other folks involved in how do we really have an impact on this as quickly as possible. So the areas that we identified were 7, and they listed there on your Pitt County Health Improvement Group handout I gave you. Number 1 being smoking cessation. We recently had Aden go with tobacco-free parks, and we've got also had Bethel do the same, Winterville. So we're trying to get Farmville and Greenville to follow suit along with Grifton. All of them have interest. They're just trying to get it done and get it scheduled with their meetings. Number 2 there is reducing newly diagnosed cases of chlamydia, and we've spent a good amount of time talking about that issue here with this board. But then if you look down below that, you have adult obesity, and you can see these rankings on the form here. I can blow this up a little bit higher magnification, but adult obesity is 30%, which is right at where the state average is. But nationally, it's very poor when you look at that rate. Adult smoking came down just a little bit. We were at, I think, 22% last year, and it came down to 20. So that's great, but we still are above the North Carolina rate of 18%. So we need to bring that down some more. Adult obesity, I mentioned that one. The next one down is binge or heavy drinking. Excessive drinking here, we're at 19%. The state's at 17%. The top performers are at 13%. So we see we've got some room we can make there. Access to locations of physical activity, that's here. 79% versus 91% with top performers. So that all goes to say that we need more parks and recreation facilities compared to other places in the state and across the nation. A1C monitoring of Medicare enrollees, and that has down here diabetes monitoring. We're at 88%, and where the best performers are at 91%. And then the last one is number of alcohol-related driving deaths. So that's back up here. At 27%, we're more than twice what the top performers are. So, of course, these are things that are social determinants of health in many ways, and not things that the Board of Health and the Health Department necessarily has direct control over. So we've got to partner with other agencies in the county to help us address these things. And so we're have met with the superintendent of schools around the BMI issue, that we feel like trying to address adult obesity could be extremely difficult, and so we want to address childhood obesity, knowing that those children will soon be adults and hopefully will be not overweight when they reach adulthood. We need to get involved with law enforcement across the county to deal with some of the binge or heavy drinking issues. Planning boards will be involved in the access to locations of physical activity. We'll need private physicians' offices, African American organizations in particular, to address the A1C, hemoglobin A1C monitoring of Medicare enrollees, and then law enforcement again around the issue of number of alcohol drinking deaths. So we're starting this process of drilling down to specific strategies of how we can have an impact on these, particularly the health factors, is where we've fallen short the greatest. So I wanted to bring you up to the date on where we are with that. We still have a lot of work yet to do, but we are excited that we've got some, I think, very interested and active partners, particularly in the business community, that we met with a couple of weeks ago. We were invited to display at the Business Expo last Friday by the Greenville Pitt Chamber of Commerce, and Amy and some of her other staff were there with displays talking about to people about the social determinants of health and helping explain to businesses why these things are important for their, not just for their workforce, but for their community and for their business. So a lot to come yet on this, but it's I think some exciting developments.
Does anybody have any questions for Dr. Morrow?
I've got one, Dr. Morrow. Under the clinical care section,
Yes.
in the purple, where it talks about the physicians and dentists, mental health providers, it actually is showing us above average, certainly for other counties in the state. Does that take into account faculty at?
Yes.
Okay. So
It
some
does.
skew there then.
Very much skewed, yeah. And we've always performed well since this has been going on. This ranking has been going on about 8 years now. And we've always performed very well in the clinical care. I think I can show you we're number 8
Sure.
out of 100 for that in the state. So, and it's, yes, directly tied to the medical school staff and the
Dental
the
school.
hospital and the dental school and all of that, yeah, university.
Well, just a comment about prospective employers, look at the education of your population, and our high school graduation, it says 81% for Pitt County compared to 86% for the state, and 95% top performers elsewhere. So that's an area that we certainly need to improve on, put some effort into. Okay, any other comments, questions? Thank you very much for the report. You want to stay there to do your health director's report, or you want to?
I'll better come back and find my notes.
While Dr. Morrow's doing that, I'm going to just go over a couple of announcements here. One is we're pleased to announce the Board of Commissioners reappointed Dr. Lady Aycock as our optometrist on the board. So congratulations again, Dr. Aycock. We appreciate your contributions. That was just occurred yesterday. So, and also our own Dr. Morrow was recently appointed to the North Carolina Institute of Medicine. That's a great honor for him, and a good thing for Pitt County to have another voice at the state level. So congratulations, Dr. Morrow, on
Thank
leading
you
the
very
board,
much.
and congratulating you on that. So.
Thank you. So a few things, and I wanted to bring you up on my report. Our mobile dental unit, I think I mentioned at our last meeting that our mobile dental unit had been sitting still for about 8 months because we didn't have a dentist. But thanks to some partnering with the Bernstein Center, Dr. Rob Doherty helped us staff that. It's been going now for the second week. And it's going pretty well. We're out at Farmville. They're seeing anywhere from about 10 to 15 children a day. Had a few glitches. We've got a motor on a suction pump right now we're going to have to get replaced. It's hard to do hard to do dentistry without good suction, and so we hope we'll have that fixed this week. But that really is going well. We're excited about being able to see those children before the school gets out. So we've only got about 5 more weeks, but they've already seen over 100 children. So just want to let you know about that. We do have a dental position in our budget also, so we're hoping that if the budget is approved, we'll have funding to hire full-time dentists to take the place of them if we need to. We're also going to continue to explore continuing the current option as well as look at any other options that may be available. Also, just want to make you aware we are going to be applying for a Blue Cross Blue Shield Foundation. We had gotten a grant 4 years ago in 2014. It was a planning grant of about $15,000 to help with the West Greenville Health Council initiative. It also helped us get the Pitt County Farm and Food Council started at that time. And so we're going to be applying for full funding through the Blue Cross Blue Shield Foundation this summer. And I'm working with Dr. Nancy Winterbauer from the Department of Public Health over at ECU to get that application completed. So we'll keep our fingers crossed on that. Also wanted to let you know that the General Assembly is back in session, if you didn't know, in Raleigh, and we do have a request in from the Health Directors Association for communicable disease funding to the tune of about $8 million. That funding I presented to y'all earlier this year about that funding has been flat for about 25 years. So we're hoping we can get some additional funding. That would mean about $80,000 for Pitt County if we can get that. Also, am going to be doing a walk with a doc, educate, exercise, and empower. This is later at the end of this month. It's going to be Wednesday, May the 30th at 9:30 at Alice Keene Park. And I'll just pass this around, but I've been invited by the folks at Vidant to be their first guinea pig, if you will, for Walk with a Doc. And I hope that'll be something that will, this was started by a physician, I forget where he is, but it's spread across the country and is really helping people educated and motivated about improved physical activity in particular and improved nutrition. Also just wanted to let the public know that we are entering tick season again as the weather warms up, and I think I have a interview scheduled tomorrow to talk with some media about tick-borne diseases, but in particular we're concerned about Rocky Mountain spotted fever, and Lyme disease is not as big a concern here as it is in the Northeast, but we do have cases of Lyme occasionally in North Carolina. And ehrlichiosis is another one that we see quite a bit in North Carolina. And then Starry, which is a lot of people don't know about Starry yet, but it's a southern tick-associated rash illness, and we don't know what causes it yet. Hopefully we'll figure that out one of these days soon, but in the meantime, that disease looks a lot like Lyme disease in its presentation, and but is not as serious as Lyme disease, doesn't have the complications that we're sometimes seen with Lyme disease. And the last thing I wanted to update you on was I did get a call today from Pitt County Animal Control. We had a raccoon that was attacked a dog in the Winterville area yesterday, and that raccoon was captured and sent off for testing, and the state public health laboratory called us today to notify us that that raccoon was rabid. And so we've contacted the family of that dog. The dog has been put into quarantine, and we're going to make sure that if anyone was exposed to that rabid raccoon, they'll get prophylaxis with appropriate vaccinations. But just again, take advantage of this opportunity to remind people to please get their animals vaccinated and keep them up to date. We are seeing, we did have a cat in the Aden area also a few months ago with rabies. So if you haven't had your pets vaccinated, please do so as soon as possible. And that's all I have.
Very good. Does anybody have any questions for Dr. Morrow? Just one more business item here. Kristen reminds me that we had not yet approved the closed session minutes from November 14th of 2017. Those were just circulated prior to the meeting, so I hope you've had a chance to review them. Are there any corrections or additions to those minutes? Hearing none, is there a motion for approval?
Second.
Second. Any further discussion? All in favor say aye.
Aye.
All right, thank you. The minutes, closed minutes are approved.
You want the minutes back, Dr. Morrow?
Yes, please. Okay, is there any further business tonight? All right, hearing none, is there a motion for us to adjourn?
So moved.
Is there a second? Any further discussion? All in favor say aye. Aye. All right, thank you very much. We're adjourned.